All right, so day one of the pre and postnatal workshop, and maybe what we could do is just start off with introducing ourselves, where you are, what your background is, and then ultimately why you are doing this workshop, what you want to get out of it at the end of the day. So maybe we can start with you, Julie, because you're just on the little top of my picture here.
Okay, I qualified in 2019 with Renee in South Africa. I live in the UK in a small village called Rainford in the northwest of England. And I qualified quite late in life after retiring from the civil service. So I set up in the village here and I've got quite a few classes ongoing, and then lockdown happened. And then I've done a lot more courses with Renee since. I've passed my intermediate and advanced maths, and I've done lots of other workshops. So I've been teaching on Zoom, and now the halls have started opening up again. And I'm also working in a golf club 3 times a week. And I've just been offered another job as well, which Renee doesn't know about. There's like this big farmhouse that's got a cafe and all these outgoing activities going on, and she's got a room there that she wants to make into a studio. She wants me to teach Pilates, and you're going to do breakfast after Pilates and all this, that and the other. So that's another something that's maybe happening in the future. So today I want to do this. Not that I've seen anybody before pregnancy or in pregnancy or after pregnancy, but I've got a lot of older clients, which I think will help with mobility issues as well. So I'm just grabbing every opportunity I can for as many workshops as I can, really, to enhance my knowledge.
Awesome. Well, by the sounds of it, you're getting so busy, you're not going to have much time for workshops in the future.
So all my workshops are crossing over in my brain, and I'm like,
yeah, yeah. No, but you know what you said is absolutely right. So I mentioned this earlier. This is like a pre and postnatal workshop, but it's all completely relevant and appropriate for older clientele, people that are less mobile for whatever reason, either they've had some kind of injury or physical issue, or for people that are perhaps overweight and they're having a difficult time moving. So, I mean, this is all very applicable knowledge to that whole scenario, which it sounds like you're attracting a lot of the older clients. So that's fantastic, Julie.
Probably because I'm old.
Not at all. I'm sure that they're looking at you going, my goodness, we want to be able to do what Julie's doing. So I think it's fantastic. I mean, you've got that niche market as well, which is great.
Yeah, there's not a lot of competition where I live. So.
No. And you're an hour behind us, hey?
Mm-hmm.
Okay. Well done on getting up bright and early. Cool. And then Bernie, you're just on the other side on my screen.
Good morning, everyone. So I'm Bernie. I did my yoga training with the Source now in January. And just as we got up and running and we literally just finished off our course, COVID happened. So it couldn't go too far with that, but it was good. The course was amazing. So this is just to really expand my knowledge as well, so that I've got that toolkit with me, so that I've got a full picture of understanding, especially for, like you said, the older and also obviously people who are just less mobile. So I'm super, super excited to do this.
Awesome.
And I'm in Cape Town, but yeah, sorry.
No, that's all good. I knew you were in Cape Town. Awesome. Fantastic, Bernie. Cool. And then just directly below you is Kelly. Oh, hold on. There we go. Yeah.
Good morning, everyone. So I'm Kelly. I'm in Qatar. I'm a mum of 2. I'm a freelance teacher, personal trainer. I did my yoga as well. When I did the yoga, we didn't really go into post and prenatal, which I was disappointed with because it was on the course structure. So the only course I ever did was with Renee when you come to Qatar, and we did the workshop there. So I still have all of that now. I still got the workshop manual. So I really wanted to do this again and learn about the exercises and how they feel, because I'm always afraid about the core ones with pregnancy, because you're not sure what you can do. So I see all the pictures and stuff, what to do, but how does it feel? So I'm excited to try that out as well.
Fantastic. Yeah, and also a lot of the sort of the basic mat course and the 200-hour yoga teacher training, they might sort of discuss this is not advisable for pregnant women, etc. but it doesn't necessarily dive into all the details that we're going to cover, because pregnancy is considered like a special population, kind of like if you're working with somebody with osteoporosis, scoliosis, children, pregnant women. They're all sort of areas of specialization. So it's nice if you've got this opportunity to dive a little bit deeper and apply it to what you've already got with the yoga and the Pilates as well.
Even with the personal training, it says you're covered for special populations, but there's nothing in there for them. So what do you do? It's like, people are afraid to train pregnant women, really.
No, exactly. You don't want to be held responsible if anything doesn't go well. Exactly. Cool. Nice to have you on board, Kelly.
Thank you. Happy to be here.
Cool. And Maya, you're next on the screen there.
Hi, everybody. I'm also from Cape Town. I'm just outside Cape Town in Stellenbosch. I am a yoga teacher, did my 200 hours in integral vinyasa. And then after that, a year or two later, did yin through the source with one of the yoga. Yeah, I was just trying to think of her name.
Yeah.
That for me was like a homecoming. I just love yin yoga. When I first went to my very first yin class as a student, I loved it. And when I taught my very first yin class, I just thought, absolutely. My background is mindfulness meditation. So I started teaching mindfulness meditation in about 2013 or so. Did some training with Buddhist monks in Cape Town. And so I teach at a studio in Stellenbosch. And for the last 9 months, I've had a pregnant lady in my yin yoga classes. And she's due on Saturday, and she came to my last class on Thursday last week. Where are we now? Tuesday? Yes, Thursday and Friday she was there. And I said to her, she better start booking 2 spots, one for herself, one for the midwife. And so we were chatting on the morning that you sent that message out, Renee. She said to me she'd be so keen to do some kind of postnatal yoga. And previously, I think I would have been quite nervous to do it because I'd never had a pregnant lady in the class. But having kind of gradually gone through the months with her, as she got bigger and bigger and bigger, I felt a little bit more confident about it. But saying to her that I wasn't trained in postnatal yoga, I said, I'll think about maybe putting something together. And then your message came through. So
serendipity.
Yeah, that same evening. So I sent it straight on to her and I said, can you believe this? And she said, are you going to do it? I said, yeah, absolutely. So having thought about it subsequently, it's really interesting for me to do this because, as you were saying, it's also for people that are maybe struggling with core strength, or menopausal ladies, for instance, where you need to strengthen the pelvic floor. And also people that are slightly overweight or carry more weight in the middle, because the stereotype stringy yogi is, I mean, you know, everybody practices yoga now, big, short, tall, old. And so for some of the larger people, it's really difficult to hold yoga poses because they can't fold themselves in the same way. So I'm thinking that it's quite good for that. And people with injuries, and I think also maybe people that are a little nervous about trying a strong yoga class might feel comfortable to come to a class where they know it's going to be a little bit more gentle.
Absolutely.
So that's my thinking. Yeah.
So,
and
but Maya, what you said there is so right. You know, if you go onto Instagram and you take a look at people doing Pilates and yoga, I mean, they have the most perfect physiques and they're doing these incredible movements and postures. And it's very intimidating. It can be very intimidating, and then people don't want to even try it, you know? So I think it's so nice to be able to kind of put it out there that it's accessible for everyone, and it is for people that are older, people that have never done exercise, and that's where this kind of slots in as well.
Yeah. And I think also maybe after you've had children or have just given birth, your body is very loose. I think your hormones, still, you know, that hypermobility.
Yep.
You know, a friend of mine has hypermobility in her knees particularly, and she struggles with yoga. And she was saying to me that actually maybe a postnatal class would be good for her to go to because she's got knee injuries. So I think it's kind of across the board. So I'm really to see what.
And definitely that's actually something that we discuss here as well, is about the whole hormonal fluctuation and how it actually does affect ligaments, muscles,
Yeah.
joints. Yeah.
Yeah.
So that's something we'll definitely discuss.
Yeah, hi everyone. I'm looking forward to
Hey.
the rest of the month with you.
Nice to connect with you again.
Likewise.
Cool. And then Sue, how are you? Little intro.
I'm Sue. Can you see me?
How do you do?
I live in Lilongwe, Malawi, and I trained with Renee. I started in 2017 and finally finished and graduated in 2019 my basic mat Pilates. And then this year, obviously due to COVID, haven't been able to teach very much, but I've been attending all of Renee's classes and courses, or as many as I could possibly attend, because I also teach horse riding as well. So I'm always here and there and everywhere. But this course for me, I do have some ladies that come to me even now, and they've sort of given birth or just given birth or gave birth 6 months ago. So they're really weak. And I remember the first time that someone came, I was WhatsApping Renee, what do I do? What can I do? What can I do? Because I was Googling and everybody contradicted each other. You can do this, and then you can't do this. So this is perfect for me, because it seems to be in Lilongwe that everybody comes here to work and has babies. And then, they come from overseas and they have babies, and then they need some help. So this is really interesting for me. It's just another add-on, but I think something very important for myself as well, because as I get older,
they not have televisions there?
Sorry?
Very, very erratic. Oftentimes there's no power, no ESCOM. So I guess then, what do you do?
Exactly.
Hence the babies.
Yeah.
And Sue, the whole thing about there is so much information that is available on YouTube, online, Google it, and you've got to be able to filter through it to kind of see what actually works for you, and because there is a lot of contradictory information as well, and sometimes that is purely, if you take a look at the dates of the research, it could be something that's online from 15 years ago, and that's what everybody was practicing and doing back then. But 10 years down the line, 15 years down the line, we've learned a little bit more, we've got a bit more research, and so things do evolve, but it's difficult to know how to filter through everything as well, right?
I was a man-handed. I didn't know what type of class to give this lady.
Exactly. Well, there you go. So hopefully at the end of this, you're going to come away with some useful info.
Brilliant.
Cool. All right, guys. Well, a little bit of a background for myself as well. I mean, I've worked with all of you, some of you a little bit more than others. But my whole background is that originally when I was in Vancouver, I was a dancer. I left the dance world to go to university to study nutrition. So I graduated with a Bachelor of Science in Dietetics. I never practiced one day. I just kind of realized that I wanted to be a little bit more proactive on the health and well-being side. So as a result, I ended up going into the gyms more. So I became a personal trainer, an aerobics instructor. So, I mean, I was in my early 20s then, living in Vancouver, and it was during that time that I did my very first pregnancy course and workshop. And, I think at that stage, I was so far removed from being able to relate to anyone that was pregnant or had had a baby or was going through those physical consequences of having gone through pregnancy. So I theoretically knew the information, but I really had no understanding or empathy towards it. So it was all that knowledge sitting there. And then again, I continued on with my career, ended up coming to South Africa, became a Pilates instructor, which is really my career. But since then, I've been adding a lot of other modalities to it. So yoga with vinyasa and yin, gyrokinesis and gyrotonic, which is all the spiraling and the mobilizing movements. And then more recently, really diving into all the fascial work. So anatomy, slings in motion, yin yoga, and I'm just really fascinated with fascia in the body and how it ties into movement. So one thing you'll notice is that this course is not a Pilates pregnancy course. It's not a yoga pregnancy course. It's a pre and postnatal movement workshop. So we're going to be covering all different kinds of movements so that we can all take away what we need from this as well. But I had Ella, my daughter, 9 years ago, and I very quickly, now I had a fantastic, easy pregnancy. I had no morning sickness. I had no physical issues. I still remember the one day, I must have been about 8 months pregnant, and I tried to walk between 2 cars and I didn't fit. And I was like quite shocked, you know, because I didn't feel like I was pregnant. Like, why couldn't I walk between these 2 cars? It was like a bit of a shock for me. And I had a great pregnancy, which I was very thankful for, great delivery. And it was only after I had Ella that I started getting physical issues. So it's been a personal learning curve of just kind of going, you can have a great pregnancy, you can have an easy delivery, and then you might just pay the price later, you know, and so how do you deal with that after the fact as well? So that's why I've made this a pre and postnatal course as well. And the other thing is that when I was pregnant, I suddenly realized, like, all those movements and exercises that I was happily teaching people, and this is great when you're pregnant, I was just like, I hated that. You know, when you go onto all fours in a cat stretch, I hated that. I felt like my whole tummy was like, oh, dragging down. But everybody says, oh, this is so wonderful when you're pregnant. So it's realization as well that pregnancy is also very individual. You know, what feels good for one woman in pregnancy might be something completely different for somebody else in pregnancy, and our bodies react differently all the time. So that's a lot of what we're going to talk about in this course as well, is how do we adapt, how do we modify, how do we make it work for each person that we're working with, either if they're doing a one-on-one, which is great, or if you're teaching a group class, how do you offer as many possibilities so that people can make it work for them as well? Okay, so you guys ready to dive in? Cool. So did everybody get my email with the link to the manual? So I know some people may have printed out a hard copy for themselves. If you did, that's great. You can write your notes on it. If you
65 pages.
Oh my goodness. Julie, did you print it out?
Hello.
Oh, I wouldn't expect anything less. So if you've got the hard copy, that's great, because then you can make your notes on it. Otherwise, just have a piece of paper ready, a notes book where you can make additional notes, or you can just sit back, listen, absorb, and then you can use these recordings as a chance to review later as well. So I'm going to open up a little screen share here for you guys. So this is your pre and postnatal movement course. It is a short course. And so when you guys actually finish on the 28th of August, you guys will be getting a certificate of attendance from the Conscious Movement Education. So this falls under the body of CME. So that's that little logo right there. And then we're going to go through some theory of what happens during pregnancy, the physical changes for mom, the physical changes for baby, and then we're going to start talking about different exercises, what to focus on, what are contraindications, etc. So it's a pretty comprehensive course. So over the next 6 sessions, we're going to be jumping around a little bit within the table of contents here, within the manual, so that we can start to piece this all together a little bit like a jigsaw puzzle so that it makes sense for everyone. So if you take a look on page 3 here, so the source, and originally we were simply called Renee Watson Pilates Studio, and then when we opened up the source 7 years ago, we fell under the umbrella of the source since we were doing both Pilates and yoga, and we've taken a lot of women through their pregnancies and post-delivery as well. So a lot of women opt to do private sessions simply because either they've never done yoga or Pilates before. And it's one of the things where we just kind of say, look, if you've never done it, or if you haven't done any exercise before and now you're pregnant, it's just maybe a little bit safer to focus on private or one-on-one sessions. We have in the past also offered group classes. And what's interesting with the group classes is that we do have this wave. So we'll suddenly get like 6 pregnant women that all come into the studio, and it's amazing because they all go through their pregnancy together, they have an experience, they have a bonding together, but then all of a sudden within like 1 month or maybe 6 weeks, they all have their babies, and then we've got no one in the class. So something that you guys might actually find as well is if you decide to offer like a pre or postnatal class, that you might have this full group and then absolutely no one. So it's something to consider when you're actually promoting and marketing these, is just kind of like saying, great, we're starting the next group on this date, and you know you're going to be working together for the next like 5 or 6 months, and then you might have a little bit of a gap before you start the next group as well. Okay, so it's always been quite interesting to see how that comes and goes with our ladies. So some women, as I mentioned, have very easy pregnancies. So you have to do very few modifications for them. Whereas other people have maybe, they get really big tummies, or they suffer from a lot of hormonal imbalances, or they feel that their joints are very lax or they're very unstable. So you've got to be prepared to offer a lot of modifications and assists. And that's where the props actually come in very handy as well. We're going to talk about those later. So every single day in pregnancy is also different. So mom might walk in one day and she's feeling great and energized, and then the next class she might be feeling very tired, a little bit irritable, a little bit more tender. So you just have to kind of go with the flow with each class as well. It's great to give moms permission to stop when they need to. Give them permission to tune into themselves and modify whenever they need to. I think sometimes when you're in a group setting as well, you know, you kind of see the person next to you doing an exercise, no problem, right? And we've all had that when we're in our Pilates and yoga classes. And to be able to stop and tune into yourself is really important. How am I feeling? How is this feeling on my body right now in this moment? And if it doesn't feel good, give yourself permission to stop, or to just step back a little bit, or to contain the movement, I think is really important for pregnant women as well. And what is the difference between yoga and Pilates? So some of us have had an experience of both, while some of us have been more focused on yoga and some of us have been more focused on Pilates. So at the end of the day, both of them are mindful movements. Okay, both of them are about just being aware of your body, being aware of your mind and how you are feeling in any given moment. So they might appeal to different women during pregnancy for different reasons. Both of them focus on breath work. So guys, we will be going into breath work. Both of them focus on pelvic floor. So we're going to be talking about pelvic floor. And both of them keep the body strong to go through pregnancy, through labor, and to recover postnatally as well. However, the difference lies in some of the repertoire. So there is a bit of an overlap in the repertoire as well. But the repertoire I'm going to teach you guys, some of it is more Pilates focused and some of it is more yoga focused. And I see no reason why we can't sort of overlap them and we all use all the repertoire as well. Some of the cueing is a little bit different. So what I notice as well on the Pilates side is that we definitely cue sort of the physical aspect a little bit more. It might seem like a little bit more clinical, in other words. Whereas the yoga might be a little bit more feeling based or spiritually based of how we cue the body. So yogis might talk about the energy a little bit more, you know, turning your gaze inwards. Whereas Pilates might be focused a little bit more on the physical, you know, how does that muscle feel, you know, feeling the stretch, etc. So those are just a few of the little differences that we might see between the two modalities. Both of them complement each other, okay? And I think ideally we should be incorporating both of them into our movements. You're going to find such benefits from both of them as well. So some of the benefits of Pilates and yoga during pregnancy. So doing a regular exercise that's focusing on endurance and strength is going to be beneficial during labor, for example. So I've got this lovely friend, Karina Avni. She's a pelvic function physio at Kingsbury Hospital. And she says, you would never go and run a marathon without doing some kind of training, right? And it's exactly the same here with giving birth. You know, why would you think that you can actually physically manage going through labor without doing something to be able to hold your muscle strength, focus on the breathing, the mental strength as well? Exercising also helps to moderate hormonal levels. And I can't remember who it was that was saying that maybe with menopause, that this is also very, very beneficial. So, and it's purely as well because of the hormonal changes that you go through when you go into menopause. And for a lot of women, that's sort of around 50-ish. Some people a little bit earlier, some people a little bit later, but around 50-ish, you could very well actually benefit from doing this kind of work, doing Pilates and doing yoga, because it helps with hormonal imbalances as well. Maintaining good posture. So that's going to help relieve strain on our joints, on our muscles, and on our ligaments. And when we say ligaments, guys, that's just like one little portion of our fascia and connective tissue. So we could actually say that this is relieving any strain or tensioning on our connective tissue. Strengthening our core is also going to help alleviate lower back pain. So just to also clarify, when we talk about the core, and this is something we talk about sort of nonstop in Pilates, I know that some yoga teachers as well also talk about the core connection. So the core is not just one muscle. When we talk about the core, people think, ooh, abdominals, you know, let's just do crunches. So it's a little bit beyond that. It's our deepest abdominal muscle, which is called the transverse abdominis. It's our diaphragm, which is our breathing muscle. It's our pelvic floor, is part of our core as well. It's our deep back muscles called the multifidus. And then if you wanted to, you could also include gluteus maximus and gluteus medius and the hip adductors, the inner thighs, because all of those muscles also help to stabilize the pelvis, right? So when we talk about the core, it's not just abs, it's quite expansive, right? It goes all the way from the ribs basically to the top of the femur. And Pilates and yoga has a lovely focus on the pelvic floor connection. So you'll see when we go in a little bit more detail into that as well, that in yoga, they may not call it the pelvic floor. They may call it the mula bandha, which is our bottom lock, which is pelvic floor, guys. So we'll talk about that in more detail later. And then the breath work that is incorporated here. It can have a very calming effect, and it can be a huge assist if you're going through labor. So I say if you're going through labor because obviously some women have cesarean sections. They may not go through labor, okay? But if you are going through childbirth and labor, that breath work has an amazing mental focus. And then doing a Pilates or a yoga session, just that mindful movement and that sort of slowing down time is an opportunity for mom and unborn baby to bond. And also now, sort of postnatally, there are so many classes where moms are encouraged to bring newborn baby or toddlers to class, and it's still that bonding connection now with your newborn baby. And then just for mom, taking time off to do a little bit of exercise is some me time, especially if you've got other kids. You know, so you've got this very demanding home life a lot of time. Maybe you're working still, and just escaping for an hour is crucial, just to have that little bit of time for yourself. So this exercise is obviously really important for postnatal recovery as well. And, you know, so there's this big emphasis where this is going to help you with your delivery and during pregnancy. And then women may say, well, I might be having a cesarean. Do I actually need to do this? Well, yes, you do, because postnatally, it's going to give you that additional help with recovery. And then if you're in a group class, it's a wonderful camaraderie with other pregnant women. And so I know that we've had a lot of classes that have come through the studio where I told you there's this like wave of women that they're kind of like together for 4, 5, 6 months going through pregnancy. They all have babies. They are friends to this day. You know, this is like 10 years later, 15 years later. And there's that connection that women get as they go through pregnancy and delivery together. Maybe postnatally, they all get together back at the studio with babies. And it's just like this lifelong friendship. You know, if they've been through this together as well, there's that understanding that they each have. So do you guys have anything to add to that list? Like, what are the benefits of doing Pilates and doing yoga during pregnancy or postnatally as well? Anything you want to add to that?
Well, I haven't had children myself, Ren, but I can imagine for a new mom, this must be wonderful for just her mental state of being that anxiety and that fear and, you know, all that new mom syndrome that starts tending towards the end. I'm sure it does a world of good as well, just from a soothing, calming point of view.
Yeah. You know, and that's something that we're going to talk about towards the end of the course is, you know, postnatal depression. And what is postnatal depression versus the baby blues, which a lot of women get anyway. You know, the baby blues, most women get over it, but a lot of women do actually struggle with depression afterwards. And I think just having that mental space, and if you've got a space when you can come back into with your trainer, or if you're in a group and you can actually talk to other women that are maybe going through the same thing. What are the issues, you know, what's coming up for you? And I think it's a wonderful opportunity for women just to be able to breathe, express themselves, and just to be able to center themselves a little bit. Yeah.
Yeah, what Bernadette said is that girl that was in my class who was pregnant. She had a really good pregnancy, but she was very anxious because it was her first child. And so for her, the yoga was more about calming her mind, as Bernadette just said now, than it was about keeping strong in the beginning. And as she kind of settled into the idea of things and started to become a bit more relaxed about it, she shifted her focus towards body strengthening. But yeah, that was quite a big thing. Yeah, anxiety.
Yeah. So, you know, I think that's exactly it. You know, we don't actually realize. I think, you know, when I fell pregnant. So first of all, I've had a lot of friends that it took them a long time to fall pregnant. I'm sure you guys have like had that with your friends or maybe with yourself as well. And so I just kind of thought, ooh, okay, I was quite old when I fell pregnant. I was 39. So I was just like, is this actually going to happen? And I promise you, within a month I was pregnant, and I was just kind of like, I stepped back and I was just like, oh my God, what have I done? It's just like this sudden reality check of what's about to like come forth, you know? And so it is, there's just like, you've got to like, first of all, get over that. And then you're starting to deal with all the physical stuff as well. So there's this like balance between the mental and the emotional side and then the physical side, you know? So having that space to like allow it to all be is so important, right? Cool. Okay, so I'm going to do a little screen share here with you. Sorry, let me just have a look here. So before we actually read through this, I want to show you a little video that I've got, which I thought was lovely. It's off a website where obviously they want people to come in, and it's a birthing center. But what I thought was amazing on this video is they show the baby in utero week by week, and how
Wow.
you see the development of the baby. And it was incredible. I know, so when I was pregnant, so this was now 10 years ago, I hadn't had Ella yet. I went and I had one of those 3D scans. You could see everything so clearly. I mean, medical technology nowadays is phenomenal. So I'm just going to do a little screen share. Can you guys all see that? And I'm going to just turn my volume up. You guys may need to turn it up on yours as well.
Only 2 cells are needed to create a baby. 2 cells and a miracle. In just 9 months, this pair of cells blossoms into billions of cells. Gently nestled and protected in a mother's womb, a tiny human thrives. Together, mother and baby share this journey of life, this magnificent adventure called pregnancy. I hope.
Isn't that amazing?
Yeah.
Incredible.
I've got to say that mom looked fab.
I looked at her thinking, sure, okay, not bad.
Yeah, so, I mean, and also what I've found quite interesting, we're going to talk about it now as well, is that as they were counting the weeks, you notice that baby went to 40 weeks, eh? So, yeah, so that's considered sort of more or less the normal term when we take a look through now. Sort of baby is healthy and viable to come out, sort of about from 37 weeks. We'll take a look at development now so you can see why. The actual age of maturity for a pregnancy is 42 weeks. And the only country in the world that recognizes that is France, which is interesting. So, yeah, so oftentimes women will go to 41 weeks and then they're saying that you're overdue, you're late, technically you're actually not. You should be going to about 42 weeks. So I think a lot of the time it's just changed a bit because of complications that might arise as you get into those last few weeks, either with amniotic fluid drying up, that sort of thing. So that's why they've kind of moved the marker back a little bit. So it's just interesting to see how different countries view it in a different way with what is considered full term or not, eh?
Yeah.
Cool. Okay, so I'm going to go back onto our manual here. So these are some of the changes that take place during the first trimester of pregnancy. So I think you guys all know that you have sort of 3 sections of pregnancy: first trimester, second, and third. So the first trimester is basically from conception, week 1, all the way through to the end of week 12. And baby is really small at that moment. Okay, so there's just a little picture. And oftentimes, a lot of women don't even realize that they're pregnant yet. Some women go through the first trimester and they feel just like a little bit off, you know, maybe they had irregular periods before. So even though they're not menstruating, they might just think, oh, okay, well, it's coming, you know, and then it's only in the second trimester that they may realize that they are actually pregnant. So first trimester, a lot of women don't realize. So for moms, this is the time when they may have morning sickness and their class attendance may be a little bit irregular, okay? Oftentimes breasts become very sensitive and painful to lie on. So all of a sudden lying on your stomach or lying prone isn't that easy. And also that might be the first indicator to some women that they are pregnant. They suddenly realize that their breasts are getting bigger and that they're quite tender. And for a lot of women as well, they start to see quite prominent veins in their breasts, whereas they weren't prominent or they couldn't really see the veins before. And it's in this first trimester as well that we start to increase our blood volume. And that can go anywhere from 35 to 50% that we start to increase this blood volume. So that means it's going to affect our blood pressure. Our pulse becomes a little bit more rapid because we're having to pump more blood through our body. You get fatigued more easily as well. So, you know, just to explain the mechanism of that. So we have blood volume, okay, that's the plasma, for example, but we may not necessarily increase our red blood cells, okay? That might go a little bit less. So it's our red blood cells that actually carries oxygen, right? Okay, it's the hemoglobin that carries the oxygen through our bodies. So we might get increased volume, but less oxygen carrying capacity. Hence, you've got to work that much harder to pump everything through your body to carry the oxygen. And then you might be feeling a little bit more fatigued. And a lot of women also suffer maybe from anemia because of this as well. Okay, so a lot of it is dietary related, but a lot of it purely is that physiology of what's changing in your body during that first bit of pregnancy. So in this first trimester, all the organs in baby are formed. And you guys could see that. Isn't that amazing when we watch that little video? Could you guys see the heart beating? And I think that was in like week 11 and week 12. You could already see the heart was beating. So all the organs are developed. So it's the time of greatest risk in this first trimester for any type of abnormality. And that could be various factors like an increase in body temperature. You know, so in the old days, you know, German measles or rubella was a big concern for a lot of pregnant women because that temperature, that spike in temperature, could actually then affect what was happening with baby being developed as well. And that is called hyperthermia. Dehydration can affect it. Hypoglycemia can also affect the development of the organs as well for baby. So, you know, again, go back to a lot of women not even realizing that they're pregnant for maybe the first trimester. And there you are, and you're doing your hectic cycling, and you're going to the gym and doing your spinning classes. Maybe you feel like you get a little bit of a fever, so you're happily, you know, popping Panado or whatever. And if you don't realize that baby is there, it may be a possibility for abnormalities to occur. Most of the time, nothing happens. It's that minute risk of something going wrong. Yeah. Okay. And then for baby, all the organs are developing during this first trimester. Some of them actually start to function. So remember in week 12 on that little video, we could see the heart beating. So the heart is starting to function as well. And then we have little arms, legs, hands, and feet. They almost look like little gecko hands, right? Those little tiny little fingers and toes there. And baby is starting to develop their reflexes. So the arms are kicking, the legs are kicking, and they even have their own unique fingerprints starting to develop during this first trimester. So a lot taking place in this first trimester. Guys, any questions on that before we move on to trimester number 2? Everyone good? Mm-hmm. Cool. And then second trimester is sort of typically from week 13. Sorry, I shouldn't say week 15. I don't know why I've got week 15 there. Week 13 up to about week 27. Okay, this is your second trimester. So baby is now obviously getting a little bit bigger. You can actually start to see in this picture that the belly is starting to push out. And guys, typically, this is how baby lies. Head down, facing towards mom's spine, bum up. And that's why oftentimes when baby's reflexes go and the feet start to kick, mom feels like she's getting like punched in the diaphragm and it becomes quite difficult to breathe. And then the pressure of the head is going to be down onto the bladder, which is why mom feels like she kind of needs to pee nonstop as well. Okay, so this is the positioning of baby in utero. And we're going to talk about what is breech position later as well. So basically what's happening with mom here is that we have a hormone called relaxin, which is released into the body. And this is responsible for softening and relaxing muscles, and I've put ligaments, but it's basically connective tissue. So all your fascia, okay, ligaments, tendons, any of the fascia around the body starts to soften and relax. So you could get flattened feet, for example. This is due to relaxin, right? Because you have fascia and tendons and ligaments running all through your feet as well. So sometimes women will literally gain a shoe size and their feet get wider because the feet start to flatten out. And sometimes they remain that size post-pregnancy too. You can get increased breast size, which is causing rounded shoulders, tight neck, upper back, chest muscles because of that. and you're getting some gradual weight gain. You might not actually be a lot bigger than before. And around week 17 to 20 is when mom can actually start to feel baby moving in utero, which is very, very exciting. I mean, I still remember when I could actually first feel Ella kicking around inside, and it was around week 18. And then baby. So baby starts to get facial expressions that can be seen, and they can actually start to hear. So this is like a big thing, is that a lot of women like to play music specifically for baby, you know, putting headphones or putting the sound system quite close to belly so that they can hear music. You can start talking to baby. It's like a popular thing with dads to start to talk to the baby through the belly as well. And this is also where the skeleton starts to form. So when we say harden into bones, that's not exactly like the bone structure that we know, because when baby is born, the bones are mostly still collagen. They're still quite soft. Like you can't really break a baby's bone. You might get like a bamboo or a hairline fracture. It's only when baby is born and starts drinking breast milk and then having other foods that you start to deposit calcium into the bones. So the bones for baby in utero are still very soft, because imagine trying to push baby out through the birth canal if you had quite solid bones. That's not going to be comfortable for mom or for baby. So we're just talking about the skeleton starting to form here. It's not like bones like we know of bones. And the kidneys start to work. So baby is starting to produce urine and is starting to wee it out. So, you know, this is where as well, baby is getting all kinds of nutrition and fluids from mom through the placenta. That's how they're getting their food and how they're growing. And they're starting to now process that themselves. And then when they pee, it's going out into the amniotic sac. Okay. And again, the baby can flex their joints, kick their legs, and they are starting to gain weight as well. So you can see the size difference here, second trimester, as opposed to size difference there, where you may not even be able to feel anything inside as a mother. Guys, any questions on the second trimester? All good?
No.
Cool. And then we have the third and final trimester. So this is basically from week 28 to delivery. And again, I've put in here that typically it's 40 weeks. France is the only one to kind of acknowledge that 42 weeks is the actual delivery date. So there's a little bit of leeway there. And you can see here from the size of belly that baby is definitely a lot bigger as well. So the changes that are taking place. So because baby is getting bigger and there's only so much place to go, it's going to push forward onto the abdominal wall. So there's that pushing forwards, and we're going to talk about what happens to the abdominals during pregnancy. But also the rib cage needs to expand outwards. So it makes it much harder to be able to actually engage the abdominals, and it actually makes it much harder to be able to breathe, because there's this constant pushing upwards into the diaphragm from baby as well. More than likely, the pelvis is going to tilt anterior. So guys, remember that an anterior tilt is when the tailbone sticks out the back and the front pelvic bones tip forward a little bit. So oftentimes there's like quite a strong curve in the lower back here, so which is also why a lot of women end up taking strain around the lower back. So this is where core connection and strength is so important. And then again, with the hormone relaxin, there's an increase in joint mobility, particularly around the sacroiliac joint. So when you see that abbreviation there, SIJ, guys, that stands for sacroiliac joint, and the pubis at the front. So guys, just a little reminder is that the pelvis is not one solid bone here, right? You've got the right half and the left half, and it connects at the pubis here with this sort of thick line of cartilage. So remember that cartilage is quite rubbery. So it has a tiny degree of movement, which is important because it helps us to walk. Okay, we need to have that little bit of movement. But during pregnancy, it becomes much more mobile and lax. And that's partly in preparation for childbirth. That needs to be able to be a little bit more lax. And then the sacroiliac joint at the back is where the pelvis joins at the back. So you've got your right pelvis, your left pelvis, and in the middle here is the sacrum. And the joints where it connects here is called the sacroiliac joint. You've got the joint on the right and the joint on the left. And again, it's held together with ligaments, and those also start to become like a little bit more mobile. They need to, in order to accommodate the pelvis expanding for baby to be able to push outwards. But it can become hypermobile and very unstable. You know, so for example, you might see pictures of like pregnant women doing the splits, and I'm sitting there going, oh, bad idea, you know, because they are so mobile. You don't need to actually cause any kind of permanent damage, and you don't need to create that instability as well. So a big focus that you're going to see in our repertoire is actually keeping the muscles strong, because the hormones are going to do what they need to do anyway. Right? And so our job is to make sure that we actually maintain stability as much as possible. Okay. And then in that third trimester, there are some changes taking place with baby. This is the period of time when baby gains weight. I mean, most of the organs are developed, they're starting to function, everything's ready to go. Basically, they're doing that final bit of growth and development. So they're also getting some fat on them as well. So when they come out and they start breastfeeding, oftentimes baby loses a little bit of weight because they're learning how to feed, mom's learning how to breastfeed. Okay, so that little bit of fat on their bodies actually makes sure that they're okay for that little bit of weight loss initially once they're born. So at 37 weeks, the lungs are fully matured and baby is ready to be born. So that's why as well, if women are having a cesarean section for any reason, that it can be done sort of safely from 37 weeks onwards, because then the lungs are healthy and developed. And then baby in utero has this downy hair and a waxy substance that's on the skin, and they start to shed that in preparation for being able to come out, because they're not going to need it anymore once they've actually been born. Okay. And oftentimes you'll see when baby is born that they're covered in that white waxy substance, and then the midwife or the doctor will actually just wipe it off and clean baby, and that's that waxy substance right there. So guys, any questions on those 3 different trimesters? Amazing, hey? Amazing what the human body can do.
Yeah. And when you look at them now, he's about 6 foot and hairy.
Exactly. You know, it's quite incredible when you just actually realize now that pregnancy was amazing, and now they come out and they're about this size, and then how does that actually happen that they get to that? I mean, yeah, nature's amazing.
Unbelievable.
Oh.
Can I ask you something quickly, Renee?
Yeah.
So when you were going through the last trimester, one of the things that I wrote down was about the effect on the body, particularly the lower back, sacroiliac joints, and then when you stick your tailbone out, how that compensates in your hips and your groin. So I'm guessing that at a later stage we'll go into that in more detail, right? Because I think because hips and lower back are for me always such tricky areas, and also the SI joints. And I'm always nervous about getting involved, instructing people when they have unstable hips, unstable SI joints. So that would be really great to go into detail on that.
Absolutely. So then what we are going to be doing is, as we go through the actual repertoire, so you're going to see that there is a big difference between the Pilates repertoire and the yoga repertoire. So for example, in the yoga repertoire, we might be doing something, for example, that is your warrior two. Now, if you've got unstable pubis, or if you've got unstable sacroiliac joint, you're looking at this going, well, how do we modify that? Maybe we need to make a narrower stance. Maybe we need to make a smaller bend. You know, whatever it is that you're doing, it's definitely a more challenging pose. Whereas when we get into the Pilates repertoire, you're going to see what we're going to focus on there is perhaps how do we very deliberately start to strengthen those muscles around the sacroiliac joint, the hips, etc. So it's kind of taking building blocks of going, well, if somebody does have issues, maybe we just need to make them a little bit more isolated movements, as opposed to in yoga, where we're going into a little bit more comprehensive or challenging movements. So we'll definitely be looking at that in the repertoire as well. Does that answer the question for you?
Yeah, lovely, thank you. Yeah.
Cool, cool. So, and it's nice to, that's why I say it's so nice to be able to blend them together, because in a lot of ways, those standing yoga poses are more functional, you know, because women are moving around all the time. So, you know, we want to make it upright, functional, a little bit more comprehensive, but how do we actually build up to that point? Okay, cool. Okay, so let's go back. Let me just get onto my screen share here. All right, so on page 7, we have some physiological changes that also take place during pregnancy. Okay, we've got metabolic, cardiovascular, and respiratory, thermoregulatory, and endocrine. So these are different systems of the body that are going to be affected during pregnancy that we just want to take into consideration. So metabolic, so that's basically the energy that we use and we take in during the course of the day, all right? So our calorie requirements basically increase about 300 calories a day, and that's without exercise. So, you know, on average, you know, and I'll say on average, because obviously we're all different shapes and sizes and energy levels required, but women will take in around 2,000 calories a day. That's pretty much what I eat every day, is about 2,000 calories a day, all right? So, you know, when everybody says, ooh, I'm eating for 2, if you're eating 4,000 calories a day, that's just like not sustainable over the course of your pregnancy. So, you know, the whole I'm eating for 2, no. So you basically are going to be adding on about 300 calories, you know, which is like an extra sandwich and a banana, 2 bananas every day. All right, so it's not that much more, you know, and obviously if you're exercising and on an individual basis, you might find that you change your eating habits. Maybe you start eating more frequently and do the whole grazing thing, as opposed to like the 3 big meals as well. All right. So, and then also with metabolic changes. So remember that we said that very possibly you can get hypoglycemia. So guys, that means you have too little blood sugar, okay, or sugar in your blood. And so that's when you need to take a look again at your diet and what you're going to be eating, the types of foods that you're going to be eating. And it's also one of the reasons that you want to keep your exercise intensity levels low. So meaning you're not going to suddenly go out and do a huge spinning class. That just might be too intense. Pilates and yoga, fantastic. Okay, because it's like that low, gentle intensity as well. At the very end of your manual, hence it was a 65-page manual, is an appendix. And it's basically off a website called Health24, and it just gives you some ideas for guidelines of eating. Now, guys, if you're not a registered dietitian or nutritionist. We don't prescribe diets or eating plans for anyone, let alone women that are pregnant. You know, there are amazing dietitians out there that we are happy to refer to, okay? And we'll say to women, please just actually maybe contact that person. But that information is just of interest maybe for you guys to read through to see which of those foods that are maybe more appropriate because they have what is called a low glycemic index. In other words, when you eat a banana, you're going to have just a little bit of a spike in your blood sugar levels, but it pretty much plateaus before it's digested and then it's out of your system. Whereas if you're going to eat something like a lychee or watermelon or a chocolate bar, you're going to get a spike. It's got what's called a high glycemic index, okay? It's going to give you a spike in your blood sugar levels and then almost like a crash after. And we don't necessarily want to take in that many of those foods. So just personal experience, you know, I don't really think I had massive cravings or aversions when I was pregnant, but I do know, and sorry for the vegans, all I wanted were pork spare ribs and watermelon. If those were anywhere to be found, that's what I wanted when I was pregnant. It was the most bizarre thing. And Ella to this day loves both of those. So obviously it had an
Mine was olives.
Oh, really? Oh, interesting, hey?
Getting up olives.
Isn't your son half Greek? Huh?
Yeah.
Okay. So the olives, there you go, makes perfect sense. So it was very interesting. So I am happily eating watermelon, pork spare ribs, and then I went for a checkup with my gynae, and she was basically saying, look, you're eating something that's really high in sugar, and she was saying, if you don't watch it, you're going to get gestational diabetes. And I was like, what? You know, I thought I was eating so well the rest of the time, and it turned out it was the watermelon. It was just giving me this massive spike in my blood sugar level. So I had to like cut back on the watermelon and replace it with other foods, you know, at least to kind of like moderate it. So it is worthwhile having that background information just for you guys if you're working with pregnant clients as well. Okay. All right. So with cardiovascular work, so I've mentioned this before, your blood volume is going to increase quite dramatically. It's mostly plasma volume, so we kind of have decreased oxygen carrying capacity. So we do not want to do crazy cardiovascular work. Our blood pressure is dropping anyway because of this increase in blood volume. Women that are anemic are pretty much advised not to exercise during pregnancy. Now, I'm not talking about Pilates and yoga. I'm talking about cardiovascular work here. So no jogging, no spinning classes, nothing that's going to be high intensity. You want to be able to keep your heart rate relatively low, like under 140 beats per minute. And RHR, by the way, is your resting heart rate. So your resting heart rate is going to be increased. So you just want to make sure you don't exercise like crazy. And then also changes in your vascular system. And guys, your vascular system is your veins and your arteries. It's those vessels that carry blood away from the heart to the rest of the body and then carry blood to the heart and lungs, okay, from the rest of the body. That is your vascular system. And you can get heartburn, you can get cramping in your calves, you can get varicose veins. And by the way, so a lot of women during pregnancy might suffer from hemorrhoids, okay? So guys, hemorrhoids are basically a swelling of the veins around the anus and the rectum. That's what a hemorrhoid is. So again, it relates back to the vascular system changing, and it relates also to the simple fact that relaxin is affecting the fascia. So that's going to be affecting the vascular system. And now you've got the weight of a baby that's actually pushing down on the bladder and also on the rectum as well. So all of that can lead to hemorrhoids, which definitely is not fun, okay? That is also hereditary as well. I was very fortunate that I never had any problems, but I mean, we do get a lot of women coming through that it is an issue. And then also you don't want to create any kind of bearing down action when you're doing any kind of pelvic floor work, because that's going to aggravate it, right? So then you want to be aware of the position that you're working in. You might not want to do so much seated work with women who have hemorrhoids, because that can already create a bearing down action. Then you want to maybe have them reclining back a little bit. Okay, change the position for themselves.
What do you say to people? Have you got piles?
Pretty much. Now, listen, I promise you, when clients walk in and they have hemorrhoids or piles, I promise they will tell you. They will quite freely tell you, because it's so painful. They don't want to do anything that's going to aggravate it. Okay.
Renee, just a quickie, sorry. Did you say now that the blood pressure drops during pregnancy? Did you say that? Did I hear you say that?
Yeah, and that your blood pressure is generally going to decrease because you've increased your blood volume so much and you've got less oxygen carrying capacity. Okay. And having said that, you might also get women that suffer from high blood pressure during pregnancy as well. But that's not normal.
Okay.
The norm is that usually the blood pressure drops. All right. Respiratory system. So you've almost got a natural state of hyperventilating through pregnancy because you've got increased oxygen demands, but your lung capacity hasn't changed. And in fact, your lung capacity might even be less, because as baby gets bigger and there's that upward force on the diaphragm, there's less ability to be able to expand the lungs. So you might need to breathe almost more shallowly and more rapidly, which relates back to having this increased resting heart rate. And then the lateral breathing that we teach in Pilates helps to accommodate the pressure against the diaphragm. So we're going to talk a little bit about the breath work, but just a reminder that the diaphragm is that dome-shaped muscle that sits underneath the ribs. So as we inhale and the ribs expand sideways, the diaphragm flattens down this way so that the lungs can inflate like two balloons. So it looks like this. And then when we exhale, the ribs close and the diaphragm lifts up so that all the air gets expelled. Very helpful if the lungs can expand sideways this way, which is why it's lovely to encourage women to do that full wide inhale and that exhale, so that the air in the lungs has somewhere to go. So you're breathing laterally. It's not to say that you don't use the diaphragm anymore. It's just that you've got less capacity for the diaphragm to flatten downwards. Okay. And then the basal metabolic rate, that is BMR, that's what that stands for. Basal metabolic rate increases during pregnancy. So this is basically, again, your metabolic rate. How much energy are you expending? Okay. So obviously we're increasing how much we're expending because now we are having to supply baby as well. So it's quite important that we monitor body temperature. And we want to keep it below 38 degrees, all right? So we want to make sure that we're not doing anything that's going to be increasing our body temperature too much, exercise-wise. And when we take a look at how we set up our studios, it's really important to make sure that if it's in the middle of summer, if it's really hot, that you do have fans, that you've got airflow. In extreme places, like Kelly is sitting in Doha, gets super hot, like 50 degrees outside, that you want to make sure that you've got the air conditioning units working as well. And then of course we've got the endocrine system. So guys, the endocrine system is our hormonal system. It's basically how our body regulates itself, because it's the communication of the body with hormones. And relaxin is a hormone. And again, this can cause laxity or looseness of muscles, ligaments, tendons, which are connective tissue. So we definitely want to avoid any kind of overstretching during pregnancy as well. And, you know, a lot of women get so excited because all of a sudden they've got this incredible flexibility in their bodies, you know, which they don't normally have, but you actually have to hold them back a little bit. You need to rein them in slightly as well, yeah? Hence, no doing the splits, even though maybe it's the first time in your life you can do the splits. Guys, any questions on what we've just spoken about there? All good?
Mm-hmm.
Great. Okay, so I'm going to just show you another video here. Sorry, I just need to open it up. And then I'll do a little bit of a screen share with you. So this is really just taking a look at the actual mechanism of childbirth so that we can actually see what is going to be happening, what needs to move, what needs to release, so we can start to tie it back into the exercises that we're choosing as well.
During a vaginal childbirth, the first stage of labor lasts about 12 to 19 hours and starts when your baby settles lower into your pelvis. In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which usually lasts from 20 minutes to 2 hours, your cervix is fully dilated to 10 centimeters, and your baby's head has moved beyond the cervical opening into your birth canal. Your doctor or midwife will instruct you to push during your contractions and rest between them. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. When the top of your baby's head appears, or crowns, your doctor may make a small cut, called an episiotomy, to enlarge the vaginal opening. Then, your doctor or midwife will give you instructions on how to push your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily. After your baby is born, his or her umbilical cord will be cut. In stage 3 of labor, which may last 5 to 30 minutes, mild contractions will help push the placenta out of the uterus. During this stage, you and your baby may begin bonding through skin-to-skin contact and breastfeeding.
All right. Okay, so I mean, quite amazing how the baby will start to rotate in order to be able to facilitate that exit out of birth canal as well. And what she mentioned there as well is that obviously everything is quite soft. So on the baby, the skull plates, we have 8 plates on our skull. They are malleable and they can move. So that basically the baby can squeeze out, and you know, baby comes out with this like cone head, and we think they're absolutely gorgeous, which they are, but they have a cone head. Okay, and then it starts to actually settle back into a normal shape, and it takes a while for those bones to actually suture together to become the hard skull that we've got. So these joints actually suture together. They're called fibrous joints. But when baby is newborn and for the first months, there's that soft spot on the top of the skull, and it's because they haven't actually sutured yet. So we know that we must never put any kind of pressure onto the top of the skull with baby until things are actually set as well. Okay, and then there's the rotation, releasing out, and then the rest of the baby follows. You know, and it's quite interesting that a lot of people think, great, baby's out and I'm done now. But you actually continue having contractions. The uterus has to actually then send the placenta out too. And it's those contractions of sending the placenta out that actually helps the uterus start to return back to its normal shape, okay? So guys, as a general rule, the uterus is about the size of a grapefruit, okay? As a general rule in non-pregnant women, okay? And you think about how that expands to hold the entire size of a baby. It takes a while before it actually starts to return. And again, just speaking from my personal experience, is it took my belly, my uterus, a long time. I'm talking like a month or two for it to actually return to that small shape. And so again, there's a lot of information out there that some women bind. It's quite a big thing in African cultures, is that post-delivery, they bind a woman's stomach to help kind of like bring everything back and keep everything nice and tight, you know, tighten it back up together again. But it's a different process for various women. But that third stage of delivery is quite important for that as well. Okay. So what I'd like to do is talk a little bit about pelvic floor, okay? And the relevance of pelvic floor as well. So this is on page 10 of your manual. And men and women have pelvic floor muscles, okay? In particular, we're obviously concerned about women right now with childbirth and delivery. But the pelvic floor basically connects from the pubic bone all the way to the tailbone, which is called the coccyx. So you can see in this diagram here that it's the little red section right there is the pelvic floor. And basically it supports the bladder, it supports the uterus in women, and it supports the rectum as well. So you have front and back portions of the pelvic floor that basically support the front, support the back, or support the entire thing from underneath. So obviously pregnancy itself is going to put quite a bit of pressure and weight onto the pelvic floor. So it's going to have to work quite hard during pregnancy to be able to support the weight of baby plus all your internal organs. And then if you have natural childbirth, it can put a massive stretch on the pelvic floor. In some women, there can be quite a large amount of damage that can be done to the pelvic floor tissues. So it's recommended that you start to do pelvic floor exercises as soon as possible after delivery to start regaining that strength and the neural awareness and those neural connections to the pelvic floor as well. And again, I refer back to my friend Karina, who's the pelvic function physio, and she says, even if you don't feel anything, you know, if you have just delivered quite a large baby, naturally, it might feel like you've just got a giant gaping black hole down there. It might not feel like anything's happening. You just want to start even with an image, with an awareness of it, to start to regain those connections as well. And you saw in that video that they were talking about an episiotomy. So an episiotomy is basically where they cut. They can either cut straight down towards the anus, like through the perineum, or they might go slightly to the side okay, so that there's less risk of tearing all the way down to the rectum. And the reason that they would choose to do that is so that when they stitch you up after, it makes the stitching and the scar tissue very minimal. Because if somebody was to rip, which often it can happen, if there's a rip, it's almost like sewing up sort of jagged edges, and then there's definitely more scar tissue around the perineum. Women who
have a question, Renee.
Of course.
I don't know why, but I thought the pelvic floor was fascia. I didn't know it was actual muscle.
It's skeletal muscle. It is skeletal.
Right.
So there's definitely, don't get me wrong, there's fascia as well, but you've got a couple of different muscles. Let me just see if I don't have the video here, but you've got one little group of muscles that runs from the pubic bone just around the ureter, where the urine comes out, and the vagina. So you've got one little sort of longitudinal muscle that runs this way. And then you've got that one that goes from the pubic bone around the same area, but it also goes around the anus. So also longitudinal. And then you've got these cross fibers like this that basically attach from the pelvic bones. So if you were to think about pulling your sit bones towards each other, so just sit there, we're actually going to do some pelvic floor work in a second.
Do it.
Yeah, so if you were to think about pulling your sit bones towards each other, then you start to pull on those fibers inwards. Okay, and if you were to think I will not wee, it gets the first bit of longitudinal fibers. And then if you were to think I will not pass wind, that gets those fibers that go all the way around to the back pelvic floor. So it is skeletal fibers, the pelvic floor. And then of course you've got the fascia, the connective tissue around it as well.
Okay.
Yeah.
So skeletal fibers are actual muscle then, aren't they?
Yes. Yes. And they're basically muscles that we can control. So we do have smooth muscle as well. Like all of our internal organs are smooth muscle. We don't have voluntary control over them, but we do have voluntary control over our pelvic floor. We can strengthen it. We can squeeze it, connect it, relax it. Okay, so that is skeletal fiber. Cool. All right, so women who have cesarean sections, and oftentimes, guys, it's just called a C-section, should also still do pelvic floor work. The simple fact that you're actually carrying a baby through pregnancy means it's going to create strain on the pelvic floor. It's really important to learn how to release the pelvic floor as well as contract those muscles, since it's going to have an effect on childbirth. If your pelvic floor is too tight, good luck pushing baby out. You need to be able to soften and release into the pelvic floor as well. It's important to do the close and the lift of the pelvic floor, because that's going to help prevent any kind of prolapse after delivery. And then guys, remember that the majority of pelvic floor muscle is slow twitch and some of it is fast twitch. So it's important that we do training of the muscles, slow squeezes, and then quick, quick, quick. And incontinence, which basically means you cannot control going to the toilet. Usually it's urinary incontinence, so you can't stop yourself from weeing. But you can also get something called fecal incontinence, where you can't actually stop yourself from doing a number 2, okay? And it's generally a weak pelvic floor. It's common among a lot of women, new mothers in particular. So the pelvic floor work is so important. And also pelvic floor exercises, if you have had that cut, if you have had an episiotomy, it's going to help increase the blood flow to that area, and it's going to help you start healing into that area as well. So what I'd like to do, we're going to actually go over this tomorrow, but we're going to do just a few little pelvic floor exercises together so that we can start to get an idea of what it feels like and how can we cue and what are sort of the best positions that we can be in to teach this. So with pregnant women, well, in fact, with anyone that we're teaching pelvic floor work to. We want the pelvic floor to be functional in all our movements: sitting, standing, lying down. So it's quite nice to offer this information to people throughout the class in different positions. So it's really up to you to figure out where that position is. It's quite nice, I think, to teach this in a resting position or a child's pose, because that can be quite a comfortable position if you're using all the props that you need. But also, it forces the bum muscles to relax, because as soon as you go into a child's pose or resting position, you're stretching the lower back, stretching the bum. So it's very difficult to cheat, because a lot of people love to squeeze the bum thinking that they're squeezing the pelvic floor, but in fact you're not. Those are all the outside global muscles. The pelvic floor is internal, right? So I want you guys to get yourself in a comfortable child's pose / resting position, whatever you would like to call it. And we're going to just pretend for now that we're in our first trimester, maybe you're sort of postnatal. So you may not need a lot of props, but some props that you might want is a little towel or a blanket for knees. Okay, so some people like to have their knee on a hard surface. So maybe you want a little pad underneath the knees so it's nice and comfortable, okay? So even in the first trimester or postnatally, the belly might be sensitive, the breasts might be sensitive. So you might want to take the knees a little bit apart so that you've got space to move through. The other thing is that if people don't like their knees in this really bent position right here, you might want to take a little pillow. You could put it underneath the bum like that so that you don't have that direct pressure on the knee. And then the last prop that you might want is something to rest your head on, you know, especially if the sacroiliac joint is feeling quite unstable, okay? You might want to not go all the way to the ground. That might be too much of a pull on the lower back. So you know what? Just take a pillow, take a block, and you can rest your forehead on the block right there. So guys, just bring yourself into the most comfortable position possible. And this is so very tempting to like close your eyes and have a nap, okay? So just get yourself comfy, relaxing to the neck and shoulders. And we're just going to start with the back pelvic floor that controls the bowels. And I want you to think, I will not pass wind. So we're going to take a nice easy inhale and start breathing out. Think, I will not pass wind. And relax. Take a breath in. And again, exhale. I will not pass wind. See if you can find the connections to the back pelvic floor. How strong does it feel? And let's go again. Take a breath in. And start exhaling. I will not pass wind. And relax. Good. So now we're going to move our focus a little bit more specifically to the front pelvic floor. So this is going to support the uterus and it's going to support the bladder. And I want you to think now, I will not wee. So, easy inhale. Start breathing out, squeezing front pelvic floor. Think, I will not wee. And relax. Take a breath in. And start exhaling. I will not wee. Squeeze, 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 squeeze. And relax. Taking one more time. Breathing in. Exhale. I will not wee. Can you find the connections? How strong does it feel for you? And relax. Good. So stay as you are. So those were working those muscle fibers that run forwards and backwards from the pubic bone to the coccyx. And now we're going to activate the muscles that run crossways, the transverse muscles. And so now you're going to think about closing the elevator doors. It's as if you're going to draw the two sit bones towards each other. So, taking a nice easy inhale. And as you breathe out, think of closing the elevator doors. So it's a feeling almost of narrowing across the pelvis. And relax. Taking another inhale. Start exhaling, closing the elevator doors. And you're probably going to feel a connection to the pubic bone and to the coccyx at the same time. And release. One more time, take a breath in. And start exhaling, closing the elevator doors, front and back connections. And relax. Beautiful. So now we've learned how to connect those muscles, but now we also want to be able to get a lifting sensation because we really need our pelvic floor to defy gravity, to support internal organs as well as baby. So now we're going to close the elevator doors and we're going to go up one floor. So settle yourself down, taking a nice easy breath in. Exhale, closing the elevator doors and start lifting up to the first floor. Now stay there. Stay at the first floor. Take a breath in. Exhale, go back down to the ground level and open the elevator doors. And again, breathe in. Exhale, closing the doors and going up to the first floor, lifting. Keep breathing, no holding your breath. Inhale and exhale. Release the elevator down to the ground level and open the doors. One more time, take a breath in. Exhale, closing the elevator doors and going up to the first floor. Now stay there, listen to me on this next one. Take a breath in. Exhale, go down past the ground level, go to the basement. Open the elevator doors at the basement so you're getting a softening and release of the pelvic floor. And then close the elevator doors, go back up to ground level. Stay there for a moment. And now we're going to pretend that the elevator doors are stuck and the elevator is doing a tiny little bouncing action up and down. So stay there, taking a breath in, the elevator doors are closed, and quick little exhale, and we go. And lift, release, lift, release, lift, release, lift, release. Two more, one more, go down to the ground floor, relax the elevator doors open, and then slowly make your way up into a kneeling position upright and lifting tall. All right, everyone okay? Let's come and have a little discussion about it, see if you've got any questions or comments. So guys, there are lots of different ways that you can cue that. That's just the cueing that I've chosen over the years that works for me. And I use it on men and women, by the way. Okay, so men and women have all those same connections. This just happens to be very relevant right now for pregnant women. So, you know, I was watching a video the other night where this woman was saying, you know, pretend there's a blueberry and you're going to draw it up your vagina. I thought, okay, well, maybe that would work for her, and I'd love to know why she chose a blueberry, but, and then I was doing a teaching assessment on one of my other students who was saying, you know, pretend that you're sucking your thumb. You know, I was just like, okay, that, you know. So different imagery works for different people. And it also depends on what you're comfortable talking about. So for me, squeezing front pelvic floor, I will not wee. Back pelvic floor, I will not pass wind. Close the elevator doors. We go up to first level. You could take people up to second level. Go back down to ground floor, open the doors. Close the doors, go down to the basement. And could you feel the difference when you actually allowed yourself to go to the basement? It was that softening and release of the pelvic floor, right? So we need to be able to train people not only to close and lift, but to actually relax the pelvic floor. And then those were all slow twitch fibers with the slow controlled movements. And then we can do. So sometimes I'll talk to people, you know, when you have a yo-yo, okay? It's that feeling of a yo-yo so that you get the fast twitch fibers kicking as well. So you guys,
it's quite hard to, it's quite difficult to do. I think it's quite difficult to do for some people. I think it's quite, they look at you sometimes. I use the cue, pretend you've got an internal zip and you're fastening the zip and you're taking it up and you're taking it up and then you're closing it and you're opening it, you know, to me.
yes.
Especially when there's men in the class as well, I try to use that one, then it doesn't, you know, make it too obvious about wind and wee and this, that and the other, do you know what I mean?
No, listen, Julie, I think that is a fantastic cue. I think that's a fantastic cue. Why not? You know, so as long as you find something that works for people, you know, and the other thing is that when you are working, so right now the setup and the cueing I was giving was sort of more focused on first trimester, maybe second trimester and postnatally, okay? And then when we meet up on Friday, we're gonna talk a little bit more about now third trimester, there's a baby in the tummy, really pushing outwards, and how can we maybe adapt that pelvic floor cueing? So it's going to change and adapt based on what's working at that given moment. And if somebody postnatally has serious pelvic floor issues, then I will refer them on to a pelvic function physio. I refer to Karina most of the time because she is highly specialized and she does internal exams because a lot of people may not even connect to those muscles. You could be giving them all kinds of cues and images and they just have no clue how to even connect. And that's where somebody who can do manual therapy is so invaluable.
Well, it's the same with older people as well, isn't it? Because a lot of older people, women in particular, have loss of bladder control and as you get older.
Absolutely, absolutely. And that's why we kind of said, look, this course, even though it's kind of focused on pregnancy, is appropriate for so many different populations. Yeah. So guys, you're going to have a little bit of homework for Friday. Is that I want you to teach pelvic floor to someone. It can be a man, it can be a woman, it can be in person if you're in lockdown with someone, it can be via Zoom, which is also quite nice because then you're kind of forced to use verbal cues as well. But I want you to figure out 3 different body positions to teach them in. So right now we did child's pose, resting pose. You're welcome to do that one again. But then I want you to figure out some different positions where you can cue them as well. Yeah. Okay, just to give you that practice of what does it look like? How do you help them set up? How do you get them comfortable? Okay.
Can I ask a question? Sorry.
Yeah, Kelly.
So about that breathing with the, I'm a bit like afraid with the hyperventilating thing, like how to teach that breathing, like.
Yeah.
And also the breathing, I also watch some people say like, don't focus on the breathing, just breathe and just focus on the muscles. So it's a little bit confusing.
Yeah, so you know, the breathing can definitely alter the connections. It can slow the movement down or speed the movement up. So sometimes what I'll do as well is we'll do the squeeze and the lift. And then I say, can you stay there? Keep the elevator doors closed. You're at the first level. And I want you to have a little conversation with me. So you better be able to breathe, you better be able to talk, and I'm asking you to connect the pelvic floor as well. So that's slow twitch, that's endurance, and it's encouraging people to breathe. Sometimes for some people, it's a little bit like doing that, right? Like too much coordination. So, you know, based on the person of how they're coping with it. So the way to prevent hyperventilating is not to do it for too long. Do 5. Stop, take a break. It's only when you do that for a really long time that people might get really flaky. So if you just focus on doing 5 of them, then I highly doubt they're going to get into that hyperventilating state.
Okay, thank you. And the other one was about the hemorrhoids. So when you're doing the release of the back pelvic floor, is that fine for people that have hemorrhoids as well?
Yeah, very, very good question. So it's fine if you allow that softening and release, okay?
Right.
You don't want a bearing down. You don't want to feel a pushing.
Okay.
Okay,
Okay,
cool.
thank you.
Pleasure. Cool. Maya, did you have a question as well?
I did. I was wondering, when you do the pelvic floor exercises, it's sometimes, if you have a weak pelvic floor, easy to contract the abdominal muscles rather than the pelvic floor, or they seem to be so linked. And I'm wondering how you can tell whether someone's contracting their abdominal muscles or whether they're actually contracting their pelvic floor.
You know what? Unless you do an internal exam, you don't know.
And people
don't pay me enough, and I don't have enough coverage for a lawsuit to do that. So you
explain to someone, can you use words to say to someone, if you're doing this, it's your abdominal muscles, or not really?
So no, you know what you can do, and this is why I wanted you to play with the different positions. So you know when you come into the resting position, this is stretching the bum cheeks, so the gluteus maximus cannot take over. It has to be internal. So if you see somebody doing this, then trying to grip their bum, you know that they're cheating. So if you're concerned about the abdominals taking over, what you can also do is maybe to get them to lie on their backs, hands here, and then if you see this happening, you know that the abs are taking over as opposed to just internal connections. So play with the different positions, because that'll actually tell you right away if they're cheating with the more global muscles or not. Okay.
Because it's a fine movement. It's a very fine movement, and sometimes bigger muscles take over.
Yeah, absolutely. It's all those deep internal connections, and they are intrinsic muscles. They're all very deep. It shouldn't look like a big movement.
But we shouldn't see any movement, really, in theory, should we?
Well, having said that, the front pelvic floor works very closely with the transverse abdominis.
Yeah.
So you might actually see a flattening of the abdominal. So there could be like a little bit of movement. And the same thing, the back pelvic floor actually works very closely with the multifidus, your deep back muscle. So sometimes you might almost see like a lengthening of the spine when you do back pelvic floor. So, you know, you don't want to stay perfectly still, but definitely if you see the pelvis starting to move, you know, something's cheating.
Okay.
All right. Fantastic, guys. So we're going to leave it at that for today. We're going to meet up again on Friday from 9 until 11, okay, SA time. And then we'll get a little bit of feedback from you guys about how did it go with cueing the pelvic floor, the different positions that you checked it out in. And then we're going to continue on with a little bit of pelvic floor work as we go into 3rd trimester and how we would cue that. And we'll start working on the repertoire from there as well. Sound good?
Yeah, I can't make Fridays though, that's the problem.
I'll send everyone the link so that you guys can catch up. Beautiful. Guys, have an amazing week.
Thank you, Ren. That's brilliant. Thank you.
Absolute pleasure, hey?
And then
See you
Kelly,
guys.
Bye,
See you in a
everyone.
minute.